Hi, welcome to another edition of Eye Openers, the monthly video blog for North Shore Eye Health and Wellness. I'm here with Charlie once again to help us out. Happy Father's Day to all of you fathers out there. This edition is going to be a little bit special for dads so that you can have something up your sleeve when mom is worried about baby's eyes. Charlie and I are going to talk today about 3 of the most common eye conditions we deal with babies, and the ones that I think I get asked the most questions about. That would be eye alignment or eye turns. That's number 1. Number 2 would be pink eye, or the dreaded gunky eye. And then number 3 is a little more complex. It's nasolacrimal duct obstruction, but that is a kind of a chronic goopy eye. So to begin with, we'll talk about eye alignment. During baby's eyes development, up until about 6 months of age, their eyes are all over the place. So it's not a shock if their eyes are not aimed together or if one eye seems to be wandering. Don't worry about that. If it does continue past 4 to 6 months, that's something you're going to want to reach out to your eye doctor about. And in particular, the infancy exam, that's the no-cost dilated eye exam between 6 and 12 months of age, is a great thing to do to rule out any sort of eye turn or strabismus. So don't worry about it if it happens for the first few months, but after 6 months is something we want to look at. Oh, I know, it's okay. The second main thing that we run into is pink eye, or kind of a goopy red eye. Know that pink eye is most commonly a viral conjunctivitis. In viral infections, we do not have to treat, but they are contagious. In particular, however, little ones, very young and very old, can often run into bacterial infections. So if the eye is very, very goopy, a lot of mucus discharge, a lot of red going on, maybe some swelling around the eye, that's something that we want to see. If you just have a red, watery eye, in general, we want to take a look at it to determine if it's viral or bacterial. But the best thing to do is call your friendly eye doctor and have them take a look. Because if they are going to daycare and it's infectious, we want to make sure that we have it treated appropriately. Last thing we can run into with babies quite frequently is something called nasolacrimal duct obstruction. In the eye, right at the corner by their nose, there's a little duct that drains the tears, and sometimes a valve in that duct does not open properly. This can cause them to have a recurrent bacterial infection in the eye, where this red eye will never go away and the eye will be always goopy and drainy. If that's the case, certainly talk with your eye doctor about it and your pediatrician, but oftentimes it responds really well to an oral antibiotic. But what you want to do is warm compresses. You want to take a warm washcloth and you want to lay it on baby's eyes towards their nose and apply a little bit of pressure where that drainage canal is located. She won't like it, but it will cause the gland to open up all on its own. And if that valve does not open up, we can always do surgery for that. In most cases, non-surgical means will take care of it. So with that, Charlie has introduced you to the 3 common conditions we get most questions about with babies' eyes. Next month's edition, we'll be talking about vision development with infants, and Charlie will be back to help us out. Thanks. Have a good one.